So, welcome everybody to our session. We're going to be talking today about using chatbots to fight the COVID-19 infodemic. I'm joined by my colleague Rodrigue Bashizi from DRC, who will be talking mostly about the details of our work. But I wanted to start by just giving a little bit of context about Translators Without Borders and our work and the inspiration behind our chatbot programs. Translators Without Borders is a non-profit. We offer a whole range of language services to humanitarian development agencies and other non-profits all over the world. We have about 150 staff distributed all over the world. We have a community of 70,000 language specialists of various kinds in 149 countries. Our vision is really to a world where knowledge knows no language barriers, where people are not disadvantaged by not having access to information that they can understand. Our mission is to help get people the information that they need, and critically to allow them to be heard, whatever language they speak. Another critical part of this, of course, is when we say get information, is to make the information available to them. And this was part of the inspiration behind our chatbot program. What we do, we obviously, as you can guess from the name, we do a lot of translation and interpreting services in humanitarian response, crisis response, but also in a number of different development contexts. We help build language capacity at a local level and support other actors in that in their work locally. We build a whole range of language technology, mainly to help scale the work that we do. And obviously in the world of, in the pandemic world, this has become crucial as we look at being able to use technology also to remotely engage with people. And clearly the chatbot piece has been a very important part of that. And finally, a big part of our work is raising awareness about these language barriers and about the need for local language support and local language information in order to give people access, more equal access to vital information. With COVID and all of the movement instructions when COVID hit, I was in Goma working with Roddy and the team in Eastern DRC, and we started thinking about how we would be able to continue our work with all the movement restrictions that were coming in. We realized we needed new ways to be able to for people to be able to access information about their disease. And obviously, we needed this to be in their own language. So we started work on developing a multilingual chatbot called Uji, using sophisticated natural language processing technology. In this case, the languages we worked on were Congolese Swahili, the main language or the biggest language in Eastern DRC, Lingala, which is very popular, more popular in the West, a major language of the country, and French as the sort of national, to some extent, the government official language as well. We were suddenly confronted with a very fast-moving situation, and one of the first things we needed to do was to understand the language diversity and the language problem. And what you can see from this is really that in many of the countries where the languages were where the cases were spreading very, very quickly, there was a lot of language diversity. And so we could see some of these hotspots emerging. This is still an emerging situation in sub-Saharan Africa, but it was clear that we needed to be able to open up channels for communicating in order to give people access to very quick moving information about COVID. And right now, obviously, a lot of information about vaccines and other programs as the pandemic develops. Yeah, a key part I've already mentioned once, but I want to stress again, is really about not just about the access to information, as in we're going to tell you something, but really that we want to promote two-way conversation. What we mean by this is really that we want to use whatever channels we have. We want to make sure that those channels are not just speaking, but listening. And so Roddy will talk about how we're doing our listening with the chatbot. It's not just a chatbot that's going to tell you some things. It's actually going to engage with you and listen to whatever it is you want to talk about. But critical is really the idea that we can provide then information in languages that that people will understand. Our approach, obviously, as a technology approach, has an interesting challenge in that we didn't have lots of software developers already in place in Goma. So we needed to quickly develop a platform that would allow us to build these chatbots. So we needed to pull in resources from all over the world. We had a team everywhere from Singapore to Montreal and all stations in between. So the parts of the team are in South Asia, some of them are in Europe, some of them are in Africa. We needed to build a platform very quickly that would provide this. But critical to this was that the content for the bot is developed locally. What we didn't want to do was be building a generic solution for COVID-19 information. We wanted to build something that was sensitive to the local context, and therefore we quickly built a local content team. Roddy, as leader of that team, will now talk us a little bit through the details of what that meant and what that looked like, and then what we ended up building. So, Roddy, over to you.
Thank you so much, Andrew. I'm going to talk straight about the bot. Our bot is called Uji, and that is Ukingo Jibu. That is in Congolese Swahili. U stands for protection, that Jibu, that is response. We work with, like the Ministry of Health, IFRC, and our number on WhatsApp is +243 844 434 444. Next slide.
Yeah, sorry.
Yeah, we had questions like, aren't there many COVID-19 chatbots already? Yet, but most have a menu-based interface. Like you can see, the menu-based bots are robust. They're easy to translate. Trusted and recognized authorities such as WHO are using it. But when you look at our chatbot, the bad thing about the menu-based chatbots are complicated to find answers. It requires reading through lists of options. it's not very interactive, no chance to ask questions not foreseen by the content creators. Like you really need to look for, need to go through the whole menu to see what you're looking for, to get what you're looking for. Yeah, the TWB chatbot, it's fun. What we mean by fun, it's fresh, it has fresh content, it's updated on a weekly basis, it addresses emerging topics quickly. It is useful, the content is tuned to the specific local context to make sure it's relevant. It's natural. What we mean by natural, the platform uses natural language processing to engage in real conversations with users. When you look at, when you use our chatbot, you think you're chatting, you're really chatting with someone, and this is fun. It responds to users' questions. There's no navigation menu. It has intuitive interactions. It is able to read, to react to questions. We follow up, where did you hear this? Can you recommend this to your family members? Was this useful for you? So we really need to understand if the content that we're putting always on the board is useful to people, is useful to different communities. It is in relevant local languages. So we've been looking at the languages used locally in the DRC, and we thought it could be better. People really understand, not only using it, like putting it in French is not going to help all the people around in different communities, but putting it in local languages, this is so useful for different communities in DRC. It's built on an open source platform called Raza, and it has ability to derive deeper insights via custom analytics dashboards. Next slide. Yeah, as I was saying, the TW-based DRC chatbot, that is Uji, speaks French, Congolese Swahili, and Lingala. We are partnering with IFRC on content and rollout. What I mean by content is that so many people are asking us where we get content to put in the chatbot from. We have different sources, trusted sources, like the WHO website and the DRC Ministry of Health website, where we get content. And what inspires in getting this content is that we go to different communities, we hear what people are talking about in different communities in DRC and different rumors, and then we go and look for content always every single week. And then after getting the content, we have to work also on the content. We need to make sure people are going to understand this content. So we need first to shorten the content. After shortening the content, we go for translation into, if it was in English, we go for translation into French. And then after it is translated in French, we need validation. We need to send it to the Ministry of Health again for validation. After validation, it comes back to us, and then we can go through translations into Lingala and Congolese Swahili. And after it is translated in all the local languages, so I mean by local languages, Lingala and Swahili, it is put on the chatbot now. And the pilot testing is done by volunteers from IFRC and TWB partners. We have over 200 users actively testing the bot. The bot launched on Telegram and WhatsApp. It started with a focus on COVID-19, but has the flexibility to add content on other areas like Ebola. And Ebola, it's now on the bot. As you can see, if you want to interact with Uji, we have the link to Uji. Next slide. Yeah, analytics and insights to guide communication strategies. Example, people asking about child-mother transmission. So new content was created specifically to address this question with IFRC and the Ministry of Health validation. People also asking about Ebola. The tool, it's a tool for community engagement volunteers. We got feedback from IFRC volunteers that shows that they used the chatbot to learn about how to communicate in local languages after being trained in French. So these volunteers from IFRC have been trained in French, but while using the chatbot, they get always words, the clear and precise words to use in different communities so that they make sure the community understands what they're saying. What we've already learned from our users during a short pilot, we have around 2,900 users already. We have around 5,000 conversations and around 16,000 messages already with Uji on the bot, and an average of 1.72 conversation per user. Our users, as I said, are always talking to Uji in Lingala, Congolese, Swahili, and French. Yeah, I know people are asking always what our users are talking to Uji. We have different topics like when you look at, we have general information, we have mental health, we have transmission, we have treatment, we have protection. And the kind of question they're asking is, so many people want to know what is COVID. It's been so complicated. It just came and no one was expecting it to even come. No one knew about it, but so many people are interested in knowing what is COVID-19. The second thing, so many people asking about the stats, how many people have COVID-19, and rumors say sometimes that why we don't see people who have COVID-19. We want to know, they're asking about local stats and national stats. They want to know about the symptoms of COVID-19. They want to know if they can get COVID-19 from packaging. So there have been rumors in different communities in DRC that if you get a package, if you get goods coming, for example, from China, it has COVID-19 and you can get it from there. They want to know where they can get the masks. They want to know how they can protect themselves because they fear COVID a lot. They want to know if about the protection, if eating garlic can protect them against COVID-19. If I eat garlic, can I get still COVID-19? They want to know if masks are effective against spread of COVID-19. They want to know also about Ebola. Like we were saying, we had topics talking about only COVID before, but we are adding more subjects, more topics as we are going. They want also to know how to use a mask. Next. Yeah. The 13 slide. Yeah. Sorry. Yeah. The next 14. Yeah. When we're looking at what is in the pipeline for TWSP chatbots, DRC is just the beginning. We are now launching in Nigeria, Kanuri Hausa, English, and Shua, building chatbots for more countries. We will deploy the chatbot on SMS and include a voice functionality to widen our reach even further. Developing further partnerships in DRC where a chatbot can facilitate communication on a range of topics and promoting Uji to reach those most in need of information. Using a new analysis tool to get more granular analysis of Uji's conversations to inform health and humanitarian agencies who work on communication with communities. Thank you.
Yeah, feel free to get in touch with us if you want to find out more. We will we'll be happy to let you know about our future plans as well. Yeah, I hope you enjoyed the presentation.